My name is Raeesa Farooqi, Business Development and Outreach Coordinator with the Alberta Association of Immigrant Serving Agencies, and I'll be today's workshop chair. As we collectively strive to understand the historic and ongoing relationship between settlement and the land on which we are located, we respectfully acknowledge that the province of Alberta, where myself and my fellow presenters call home, is comprised of Treaty 6, Treaty 7, and Treaty 8 territories, and is the traditional lands of First Nations and Métis people. So in April 2020, a few months after the first COVID cases were reported in Canada, news broke that the meatpacking company Cargill had suffered a deadly COVID-19 outbreak, the single largest outbreak in Canada, in fact. Other than shining a light on the lack of and barriers to workplace safety, the events at Cargill and similar events across the country highlighted something else: the racism towards vulnerable workers, many of whom were newcomers. Coincidentally, at the very same time, AAISA, ActionDignity, and Rural Development Network, ARDN, were in the midst of developing a professional development course series for the Alberta settlement sector on topics related to anti-discrimination. However, from the other work being done by each organization, a need to adapt to the current events emerged and was highlighted across the board. The professional development series then shifted to 3 webinars that trained settlement professionals in viewing the COVID-19 pandemic through an anti-racism lens and using an intersectional lens to understand how oppression has been amplified for immigrants. Today, the 3 organizations who are part of this project are here to talk about that early research and training on COVID-19 and racism. Our first presenter, Mary Chu Antonio, Executive Director of ActionDignity, will be first taking us deeper into the Cargill crisis and highlighting the barriers for vulnerable workers that were in place for this crisis and many others like it to occur. Then, ACE's Executive Director, Rosh Rizvi, will be turning the spotlight to the settlement sector and what agencies were seeing in regards to COVID-19's impact on newcomers. Lastly, Jade Roche from ARDN and Tyra Erskine from ActionDignity, the 2 leads for the professional development courses that were created, will discuss the early findings from the project, how adaptation occurred, and share experiences in developing this training, in addition to practical tools and resources that you all can use in your own work moving forward. At the very end, we will have a Q&A period, and I'd like to urge everyone that during the workshop, please submit any questions you have for any of the presenters to Slido in either French or English. The code for the conference is #P2P 2020, and the room is COVID-19 and racism. So our first presentation is on COVID-19 and racism by Mary Chu Antonio, Executive Director of ActionDignity. Mary Chu is a pioneering leader, innovator, and risk taker with over 47 years of experience, working passionately in community development. She's a strong advocate of social justice, human rights, and equity for all citizens. And with that, I'll pass things off to Mary Chu.
Thank you, Raeesa. First of all, I wish to acknowledge that I'm speaking from the traditional territories of the people of the Treaty 7 region in Southern Alberta. Hi, everyone. Good afternoon. My name again is Mary Chu Antonio, and I'm very pleased to be here today to speak about COVID-19 and racism in the context of the meat plant workers in Cargill. Thank you to Pathways to Prosperity for the invitation to share from our experiences. I work at ActionDignity. It's a province-wide grassroots organization that serves as an umbrella organization for over 100 ethnocultural organizations in Alberta. Our mission is to facilitate the collective voice of racialized communities towards a more just and equitable society for all. We do this through leadership development, capacity building, participatory action research that supports public policy work and advocacy. We also do government relations and public awareness. Today, I'm going to talk about COVID-19 and its impact on the Cargill workers. There has been a lot of discussion in the public that this health crisis is a great equalizer, that we are all impacted. But as an organization, that works with precarious workers and low-wage workers, we knew that the virus would exacerbate existing inequities in our society. But this has unfortunately proven to be true, as we have seen. The COVID-19 crisis has challenged and extended our work in the community. As an organization committed to anti-racism work, we were concerned early on about the disproportionate impact of the public health emergency on our essential workers in the meat plants. This includes the many immigrants, migrants, and refugees who are racialized, working in precarious conditions, and yet recently categorized as essential. While we believe that the virus knows no race, we also believe that racialized communities are disproportionately impacted by the virus. There are essential workers. These are essential workers who receive lower wages, are subject to unstable employment, unstable immigration status, and more risky working conditions. I will be framing my discussion about workplace health and safety around the situation of workers in the meatpacking industry in Alberta. But before I do that, I would like to provide a little bit of a context. There are several large meatpacking plants in southern Alberta. Cargill, which employs over 2,300 workers, and JBS Foods in Brooks, which has approximately 2,400 or 2,600 workers. Together, they account for nearly 70%, 70% of beef produced in the whole Canada. Now, on April 20 this year, Cargill was forced to shut down because of one of the largest outbreaks of COVID-19 in the country. The outbreak in Cargill, which began with a few dozen cases, quickly grew to 1,500 cases. Approximately 40% of the worker population in Cargill, and around 600 in the community and neighborhoods. And the similar incident happened in Brooks. As the outbreak intensified in May, there have been reported cases of racial discrimination of workers. Some Cargill workers were not allowed to go to some banks if they are identified as workers from Cargill, nor enter grocery stores even if they have been cleared by Alberta Health Services. They were blamed for spreading the virus and were called the virus. So this leads us to discuss the issue of racism and discrimination during the pandemic. At ActionDignity, we believe in connecting personal experiences of racial discrimination to wider system structures and policies that create the context of racial inequities. This means addressing issues of systemic and institutional racism. Now, how does the Cargill situation, history, and experience demonstrate the three phases of racism? First, structural racism. It's a system of social structures that produces and reproduces cumulative, deeply embedded race-based inequities and injustices maintained by society. Race in our society is a social construct that serves social and economic purposes as well as political ends, giving privilege and power to certain races and depriving other races of equitable access to rights, power, and privilege. So examples of these structures that Cargill workers experience are: one, racialization of the immigration status; second, racialization of citizenship; and third, racialization of labor relations. These histories of racialization dictate and determine the disparities and exploitative conditions of racialized workers. White becomes the reference point for citizenship. White becomes a reference point for levels of privileges. Race becomes the determinant for exploiting groups of people, or marginalizing, or disposing, or deporting, or depressing wages and curtailing workers' rights. Restrictions of workers' rights and exploitation, especially among essential workers in meat plants, are manifestations of the racialization of labor relations. A second level of racism is the institutional racism that refers to discriminatory policies and practices. that create layers of barriers to equitable rights. These discriminatory policies and practices weaken access to occupational health and safety, for example, or create barriers to pathways to permanent residency through the temporary foreign worker program, thereby making workers more vulnerable to low wages and or workplace injury and health risks in the workplace. And while addressing interpersonal racism experienced by individual workers who are being blamed for the spread of the virus, for example, we cannot lose touch of the conditions that lead to their precarious situations. We need to address the root causes and systemic barriers to workers' rights by highlighting structural racism and institutional racism. We see examples of systemic discrimination in the policies that shape the experience of workers. The temporary foreign worker program, barriers within the occupational health and safety system, the complaint-driven system of the occupational health and safety system, and the difficulty accessing safety voices for all workers. Many of the workers of Cargill who ActionDignity was supporting during the COVID outbreak came to Canada as temporary foreign workers from the Philippines, Ethiopia, Eritrea, Mexico, Vietnam, and Afro-Caribbean countries. As workers who entered through what is called the low-wage temporary foreign worker program, they face specific challenges accessing health and safety in the workplace. This was the case at Cargill. Temporary migrant workers rely on their one specific employer for their work permit and their right to remain in Canada, which profoundly disincentivizes complaints over workplace safety. Workers are sometimes dependent on their employer for a referral for permanent residence. And should they become sick or injured, they fear losing their job, their work authorization, and could be sent home. So as we saw with Cargill, it is very difficult for migrant and immigrant workers to access their occupational health and safety rights in the workplace. Occupational health and safety system is driven by something called internal responsibility system. So it is a complaint-driven system where workers must assert their rights to safety. They need to complain. And this system ignores the power differentials between an employer and employee, which might be impacted by variables including race, immigration status, gender, length of time in Canada, age, and even language ability. As a result of power differentials between employer and employee, between management and workers, workers are often caught between tough choices, or as the Filipino workers term, kapit sa patalim, which means clutching the blade of a knife until your hands bleed. This implies willing to risk death or injury, knowing the dangers of going back to work during a pandemic. What drives them to risk going to work during a pandemic could be fear of losing their chance to apply for permanent residency, fear of not getting paid for their monthly survival needs, fear of reprisal, fear of termination, and even of deportation. So kapit sa patalim, or clutching to the blade of the knife, could also mean taking advantage of the monetary incentives despite the risk of getting the virus and spreading it to their family members. What you see here is a memo from the Cargill management that says, worker safety is our management priority. But what does it say in the small letters? That if you continue to complete your scheduled weekly shifts for 8 consecutive weeks, you'll get a $500 bonus, or you'll get a $2 per hour pay incentive for all the hours worked up to the end of May. And that was when the peak of the outbreak was happening. This is exactly the time when Benito Quesada was also one of the workers died of COVID. On April 12, 2020, there were 38 cases in Cargill. And at that time, 250 plus residents from High River, particularly the Filipino residents, submitted a letter to High River Mayor Craig Snodgrass and to the media. They pleaded to close Cargill for at least 2 weeks. Sounds familiar, eh? here in Alberta now. These were family members and neighbors of the workers themselves who said, we need to close Cargill because there were already 38 cases. The union also called for the facility to close, but these pleas were unheeded. What happened after? Workers continued working elbow to elbow until April 19. By April 19, 7 days after, there were 358 cases in the workplace and among their households. So in Cargill and JBS combined, 3 workers died one after another. Hip Bui on April 19, and a worker in Brooks on April 26, and then the Mexican worker Benito Quesada on May 12. In addition, 5 household residents in High River and Brooks died. And the media reports by the Globe and Mail and others describe how worker concerns about the virus were ignored. The Alberta government deemed the plant essential, which added additional pressure on workers to continue working. Cargill plant reopened on May 4. There continued to be concerns about workplace safety. JBS reopened and resumed full operations on May 23rd. And up to this moment, there are workers in Cargill who cannot go back to work due to long-term impacts of COVID on the workers' mental and physical ability to work. There's one extreme case we are aware of where the COVID virus lodged on the brain of the worker, causing physical and neurological damage to the brain. Cargill reopened on May 4, the day after Benito Quesada, a Mexican union organizer, died. Workplace structures and barriers were built. Bus pick-up and drop-off points replaced carpooling. In May, a 3rd outbreak was declared at Harmony Beef, where 38 cases of COVID were reported. Recently, another batch of COVID case in Cargill erupted. A Vietnamese worker is now in quarantine as I speak. What has ActionDignity done to support workers to address the situation? Treating meat plant workers with respect, dignity, and appreciation is very important. We do this by humanizing workers at Cargill and celebrating their life. Collecting stories of pain, struggles, fears, hopes, heroism, and resilience are very important to raise public awareness and generate support for these essential workers. We held memorials where family members spoke and appealed to workers online. ActionDignity was one of the first respondents that participated in the social support collaborative along with Alberta Health Services. So there were also other immigrant serving agencies who did this work for Cargill. Together with the workers, we provided online platforms for workers to host online forums in different languages, connect workers to benefits and supports, as well as information about occupational health and safety in their own first languages, and recruiting community brokers from their own communities to help with this education session. We have supported workers' efforts to help amplify worker voices through local and national media. We helped shift the conversation away from victim blaming toward a bigger conversation around systems and policy issues. Workers' families and allies named the issue of racism and the need to address racism. We helped ensure culturally accessible support services for workers and families. And these are some of the lessons and some of the recommendations for workers' empowerment and workplace safety that we've learned from our experiences. First, the need to focus on structural and systemic barriers to workers' safety. We need to understand that it may be difficult for employees to voice concerns about safety. We as community need to hear them when they do. Employers and community members can advocate for changes to the temporary foreign worker program, since their need for workers is not temporary. Second, because of the challenges facing these workers, we can help create mechanisms for workers to voice their complaints that are anonymous and where they feel safe. We can help support the creation of a safety culture that encourages workers to actively report safety concerns and is free of the fear of reprisal. Specifically, we can support workers' efforts to institute workplace mechanisms for meaningful and substantial workers' involvement in assessing and deciding on workplace safety, include workers' representation in decision-making processes in the workplace, with provisions for interpreters if needed. Third, as allies, we can support workers to be proactive about safety. We can support workers' efforts to help others understand specific health and safety concerns in the workplace, especially in relation to COVID-19. We need to be proactive to ensure worker safety and do not rely on worker complaints. Fourth, support workers' efforts to disseminate clear and concise information about workers' rights, policies, and safety in multiple languages, make it accessible, and most of all, be an ally and support workers through advocacy towards systems level change. This last slide, I just picked two references for reading. One is from the Canadian Centre for Policy Alternatives that shows the racialization of industries, especially among frontline workers and essential workers. The second is a research conducted with support from ActionDignity in collaboration with the Alberta health workers, where we conducted in 2017 a research involving 3,000 newcomer workers in Alberta, in different municipalities. And we conducted 237 workshops across Alberta in collaboration with other organizations. And this is a research that has 17 recommendations made by the workers around rights, policies, procedures, workplace safety, and workers' resources. So thank you very much. And thank you to the essential workers in opening up our minds and hearts to address racism in the time of COVID-19. Thank you.
Thank you very much, Mary Chu. All right. Our next presenter is Rosh Rizvi, who will be presenting on COVID-19 and the settlement sector. Rosh has served as the Executive Director for the Alberta Association of Immigrant Serving Agencies for the last 2 years and has spent more than 13 years in the settlement and integration sector. AAISA is the umbrella organization for settlement agencies in Alberta, and since 1980 has been working to build the sector's capacity to better serve newcomers by fostering collaboration, professionalization, and member-driven research and policy work. And with that, I'll pass it off to Rosh.
Thank you, Raeesa, and thank you, Mary Chu, for your presentation. As Raeesa just mentioned, AAISA's role is as the umbrella organization within Alberta. In that we represent some 53 agencies now who make up our membership. And the work we do is really aimed more at that systems level, whether it's around training, whether it's around advocacy, whether it's around policy, whether it's around research, but we really try to focus on that systems level and with an Alberta-wide lens. And this presentation will very much follow that. Being an indirect service provider, we don't look at things through the same lens as those organizations who are working on the front lines with newcomers. We look at things from a little bit more macro lens, and in that regard, for my presentation today, we'll talk a little bit about that as well. That will kind of play in that more systems and policy angles of the work and of the needs themselves. So first, I'll talk a little bit about AAISA's response. And in AAISA's response, it's more so the sector's response than just AAISA's response, but just how we came about supporting the sector, what we heard from the sector, and the ability to work with various levels of government. And that's where I'll start in terms of knowledge mobilization and advocacy. All of this touches on racism that goes hand in hand with COVID-19. but that was one element within the broader COVID spectrum we were working on, just in terms of what we were seeing, what we were hearing from the ground up, and what we were able to provide as an agency. So that knowledge mobilization and advocacy, especially in the first days of COVID, the first months, I should say, of COVID, were the biggest things. And I really would like to thank all sector representatives, as well as the various levels of government, up to and including multiple ministers who met not just with AISA, but with umbrella representatives across the country, with CISA, ACSA across the country, and really allowed us as a whole to present what the sector was experiencing, and gave us the opportunity to take the feedback from the sector and meld that with the policies that were being presented from IRCC. That really allowed IRCC to truly understand the breadth of impact of the policies they're making, and allowed for more back and forth to ensure policies weren't just going to meet the needs of the broad category of newcomers, but also many of the different categories of newcomers who may not fall into the typical newcomer immigrant pathway. This also led to the creation of many first language resources for newcomer communities, and a lot of thanks naturally goes to ethnocultural community organizations like ActionDignity, who did a lot of that work on behalf of the sector. Another piece from our end was Ppe Coordination. Ppe Coordination for certain agencies, and the most emergent agencies being the resettlement service providers. Through that coordination with the sector, IRCC was able to provide that for the resettlement agencies. However, when it came to the other agencies, whether they be language schools, whether it be settlement providers or the like, it was more so about coordination, again, knowledge mobilization in terms of finding vendors, and even in AISA's case, purchasing on behalf of member organizations who either weren't able to purchase themselves, or just because AISA was larger and able to purchase from multiple organizations, we were just able to get a little bit more value for the same dollar amount. We also worked very much as the initial phases of COVID passed, to do a lot of coordination, and especially coordination around reopening. Many organizations, as organizations will vary from a staff of 2 or 3 to staff of 200 or 300, many lack the capacity or lack just the available time to put together policies or really examine things in an official way. That is where organizations like AISA and our umbrella counterparts across the country can really come in handy in terms of sharing the information, the most up-to-date information coming from the government, but also putting together draft policies. For instance, with us, we put together a series of COVID policies that were fully put together for internal AISA use, but shared with the sector, because they could serve as a basis or a guideline, or even just a reference point for organizations looking to create their own policies. So that is something we were really focused on. Can you go to the next slide, Raeesa? Thank you. So speaking more about COVID-19 and the impacts on newcomers, and more so the unequal impacts on newcomers. Newcomers are affected in this way, the research has shown, in a couple different ways, both in terms of impacts on racialized individuals and racialized communities, and on low-income communities. As is often the case with newcomers, they fall into both of these categories and get hit twice as hard. There's quite a few studies out there, but many show more than a 2-to-1 ratio of racialized individuals affected versus the population composition. And by affected here, I mean in terms of those who actually tested positive for COVID. Again, similar correlation between low-income households and COVID rates as well. This is also very much true in the Indigenous communities for very much the same reasons. Financial impacts for newcomers was also quite evident. According to multiple different measures, whether you look at ability to pay bills, whether you look at just a response rate in terms of moderate or major financial impact, whether you look at effects on being able to pay rent or pay mortgages, it was often a 2-to-1 ratio again in terms of newcomers versus Canadian-born being impacted by that. And systemically, again, when we look at different professions, especially those professions that are largely populated by newcomers, the healthcare aid population is one that stands out because they were frontline for and continue to be frontline for the COVID-19 pandemic. 60% of that population is made up of newcomers, and actually 60% is made up only of Black and Filipino newcomers. And it's a target population that is very, heavily, like I said, based are composed of newcomers. And secondly, if you actually look into that target population, a lot of those newcomers working there are actually quite a bit overqualified for the roles they are in terms of the frontline healthcare aid providers. Those are just emblematic of the role of newcomers in this pandemic and why they're disproportionately disadvantaged. Social determinants of health, if we want to look at it again at a macro level, play a very important role in this. Affordable housing opportunities, access to employment, and related to that is access to underemployment, income supports, and educational opportunities, which are all areas that are more difficult for newcomers, racialized individuals, and people in low-income communities or low-income families to access. All of these have a compounding effect on the experience of newcomers. Next slide, please, Raeesa. So what I want to focus on today is also collaborative responses. From the advocacy perspective I mentioned earlier, having that open communication between AAISA and the sector on one side and between AAISA and policymakers and the government on the other side really allowed for all the stakeholders to be informed. It allowed for the sector to be informed not only of official government policies, but also policies as they were developing and the ability to inform us to inform them. And it really allowed for the policymakers, the ministers, the deputy ministers to be informed in terms of how exactly the policies would affect different newcomers. One example within Alberta of this was as the ski and snowboarding and resorts were shutting down, and many people there are many people who work there, I should say, are temporary foreign workers. As they lose their jobs, many of those jobs actually come with housing. So as they lose their jobs, it's not simply a matter of income. It's additionally a matter of homelessness. So factors like that may not be considered when looking at the broad spectrum of newcomers, but really need to be addressed because that's not something that affects just a handful of individuals. That affects thousands of individuals across the country. In response to emergency needs was where collaborative responses really took hold. I won't touch on the Cargill plant situation in High River because Farooqi has done that in great detail already. But I will talk a little bit about the community outbreak in Brooks. Brooks had an outbreak not long after High River, and many similar impacts were felt there as well. It wasn't directly tied to a meat processing plant in Brooks as well, but it was there's still heavy correlation between the two. Overall in Brooks, more than 10% of the population is tested positive over time. But what this really led to on a positive side was quite a bit of collaborative response. And this really applies to High River as well in terms of the response. First language information on staying safe, the ability to assess needs and deliver services to newcomers. This happened to the extent where every single newcomer, and in High River, I believe every single employee of the plant was contacted by an agency. There was collaboration, not just with agencies in High River in Brooks, but also from Calgary, from High River, from Brooks, from Lethbridge, all the surrounding areas where agencies were able to look at what the expertise are, what just the available human capacity is to do some of this work and really go above and beyond, but in terms of direct emergency response. So that included coordination between the provincial government to ensure flexibility in existing agreements. In these cases, because a lot of these populations, again, are temporary foreign workers and not eligible for programming through national funding, there was a lot of coordination between the provincial government and successful coordination to ensure that the resources were there to support these individuals. And when that wasn't possible, also a coalition of local funders, including United Way and community foundations, that provided resourcing for those things that were still considered ineligible, such as food security, separate accommodations, and even quarantining. Going back to some of those social determinants and their impact on newcomers and COVID, the ability to either work in an environment that is able to socially distance, or the ability to live in a situation where quarantining is possible, are really privileges that not everyone has access to. So those have shown to be very positive in terms of short-term responses to those emergency needs, because we did experience a couple of them. Can I get to the next slide, please, Raeesa? So looking ahead, just looking at some recommendations. I mean, part of this recommendation and part of what we were able to do also is the presentation that will follow by Jade and Tyra in terms of partnering with them to do a lot of training. But looking ahead in terms of recommendations, from my point of view, I've categorized them into 3 areas: proactive measures, systemic changes, and policy changes. Looking at it from proactive, a big thing which doesn't seem on the surface related or directly related anyway, is around digital literacy. And the idea that digital capacity is a right. As so many services has moved to remote services, distance and virtual services, digital literacy is something we take for granted. Many newcomers, especially those that are highest needs, aren't digitally literate. That, again, takes a bad situation like the COVID pandemic, or even the racism that stems from it, and makes it worse because it lacks the ability to actually reach the resources to support those individuals. The flip side of that is also digital capacity. Digital literacy is one thing, but you actually need access to these things. Once we were in lockdown, many people lost their access to the public institutions by which they would normally have their digital capacity. At the same time, agencies themselves overnight had to shift to almost completely virtual services and lack their own digital capacity. Another one, looking at proactive measures, goes back to the idea of collaboration and what I call strategic service leveraging. So really having an idea, a map of the services that are available, the expertise that's available, and learning not just in emergency situations, but how to have a more strategic and a more holistic view of newcomer services, rather than trying to kind of always do everything ourselves. This proved very effective in emergency situations, and is something that would only be strengthened if that was the norm going forward. Another piece would be extending services outside of the newcomer sector. So even looking at the programming that Jade and Tyra will present on, it was very well received and reached hundreds, if not even, I think close to thousands of individuals, which was excellent in terms of reach. But that is still within the service sector, within the human services sector. To really make that impact, it would be better for everyone if that also is able to reach employers, if that's also able to reach the public sector and different aspects of the private sector. Looking at systemic changes, in today's keynote, Christopher Stewart Taylor said, introspection, innovation, and that eventually leads to implementation. And I think that sums it up quite well. Looking at it that way, I won't pretend to have the answers, but I think that process will get us to the answer. I do know when we look at these things, we need to look at it from a more intersectional lens and stop looking at things as single policies that will work for everybody. Whether that means having more tailored policies for newcomer groups, that could be one thing. And another one, and this speaks back to the healthcare aid staff, looking at a systemic change where services would be not just geared to the support side of things, but also geared at creating pathways to leverage newcomer skills and expertise, which would answer certain things like unemployment and underemployment, but would also then better the sectors newcomers work in themselves. Lastly, I would note expanded service reach. And Fraser Valentine this morning mentioned that as well in terms of IRCC looking potentially at expanding eligibility to temporary foreign workers. Looking at things from policy changes, again, temporary foreign worker services is a big one. And then first language resources. Again, a big thanks to the ethnocultural communities and organizations that help put that together. And next slide, please, Raeesa, because that will be it for me, and I will pass it back to you. Thank you.
Thank you, Roche. Our last presentation today is on anti-racism during the COVID-19 pandemic, Education to Action, presented by Tyra Erskine and Jade Roche. So Tyra Erskine is the Anti-Racism and Equity Strategy Lead with ActionDignity. She's an experienced anti-racism facilitator, that has hosted sessions at SAIT, the Alberta Association of Midwives, the University of Calgary's first-year law students, and more. Jade Roche is the program manager for rural immigration with the ARDN. She first joined the ARDN as the project manager for network development and successfully launched its National Housing and Homelessness Network prior to starting the Rural Immigration Initiative. Currently, she's pursuing her Master of Arts in Community Engagement. ARDN, formerly known as ARDN, the Alberta Rural Development Network, is a not-for-profit that supports rural communities by providing resources to help develop capacity, identify community needs, and follow through on opportunities to build stronger futures in rural Canada. So now I'd like to pass things off to Tyra and Jade.
Thank you, Raeesa, and thank you everyone for joining us this afternoon. Today, in our last presentation, we'll be discussing anti-racism during the COVID-19 pandemic and take you through some of our experiences in developing a series of online training for the settlement and integration sector. So we'll start by talking about our work broadly, what our objectives were and what our process was, and cover some of the early warning signs that we saw in our work. Then we'll move into some highlights from our work, discussing what we shared then and what we know now. And finally, we'll finish off by discussing how we might approach this training if we were to do it now. So in the next slide, we're going to talk a little bit about background on this project. So as Raeesa mentioned early in the presentation, ActionDignity and the Rural Development Network were contracted by AAISA to develop and deliver 4 in-person workshops, an online facilitated course, and 3 webinars on anti-discrimination topics. So the objective of this project was to increase the capacity of the settlement and integration sector in Alberta to support newcomers experiencing discrimination. However, midway through this project, the pandemic was declared, as was mentioned earlier. So we had to adapt significantly because of this. So some of the impacts were that we were no longer able to plan for in-person workshops. We weren't able to meet in person, so we had to find out ways to build working relationships purely online. And lastly, we had to shift the content in the project so that, away from what we had originally envisioned to be more relevant to the current issues. And initially, our idea was to have one webinar on COVID-19 and 2 others on anti-discrimination topics. But once we saw how COVID-19 was highlighting the various inequalities in communities, we decided to shift this whole section of the project. And what we did first was do a scan of the current analysis of COVID-19 and anti-racism work in Canada, and saw that this was a gap. So that really influenced our decision to make this shift. So in the next slide, I'm going to talk a little bit about the topics we covered. So the first webinar we hosted was on COVID-19 and racism. So we looked at the pandemic through an anti-racism lens, exploring the media coverage, the language people were using, and the xenophobia and racism that was being amplified during this global crisis. So in this webinar, we looked especially at anti-Asian racism, anti-Black racism, and anti-Indigenous racism to increase people's awareness of how these groups have been impacted. The second webinar was on online hate during COVID-19. So this helped participants to identify online hate speech related to the pandemic and encourage them to think critically about the impacts on real life, and also explored how we might respond to online hate during the pandemic. Because most people were working online, we did see an increase, so that's why we had prioritized doing this as one of our topics. And the last webinar was on intersectionality and COVID-19. So this really built on some of our initial work and allowed us to focus on additional groups that weren't discussed, and using an intersectional lens to explore the ways in which oppression has been amplified during this pandemic. In this last webinar, we also focused on continued learning and engaging in mindful reflection for participants. And so the way it was designed was really to build on one another with the content. And so next we're going to talk a little bit just about the participant profile. So in total, we had over 800 individuals attend these webinars. And although they were originally planned to be hosted in Alberta, we partnered with AMSA to reach a wider audience once we heard about the initial interest. So the majority of our attendees were from Alberta, and the next most common locations that we saw were BC and Ontario. However, throughout the webinars, we were able to reach people in almost every province and territory in the country. So one of the benefits as well to shifting our delivery is that we also had an urban and rural reach. So one of the benefits was that making this available for free and promoting it nationally, we were able to reach more people that might have not been able to attend these type of training sessions otherwise. And while we had a diverse group of attendees, from researchers and academics to government representatives or frontline service providers, the vast majority of attendees were settlement practitioners. So based on this, we wanted to put an emphasis on providing attendees with strategies and resources that would support their daily work rather than just sharing statistics and information. So because of the level of interest, as we mentioned, we shifted our focus away from just looking at Alberta to looking at issues of racism and discrimination across Canada. So now I'm going to pass things over to Tyra to talk a little bit about our process.
Thank you, Jade. So our process of creating each of these webinars included researching emerging issues and collecting data and information from new surveys and studies, using ongoing surveys and participant polls to engage with our audience. And this helped us to inform what would be covered in the next webinars, as well as emerging issues that they were experiencing. And the last aspect involved pulling together all the available information in our presentations. And some of the initial challenges that we experienced were the lack of Canadian data and research available. And in the presentations, we noticed that there was a lack of race-based data that would help to understand who are those who are most impacted by the pandemic, and were they being provided the care and resources that they needed. Another challenge was how rapidly the situation was changing. Oftentimes, we would be pulling together the latest information or news articles available the night before or the morning of the webinar. And both ActionDignity and ARDN are based in Alberta, or were based in Alberta. And one of the challenges was expanding our scope and looking more at what was happening in other provinces and territories. And finally, the emotional effect of being hyper-focused on COVID-19 and seeing the inequities play out. And we gave updates of the changing situations between webinars. And unfortunately, there were warning signs of some of the at-risk areas before the outbreaks even occurred. And some of these early warning signs were focused on the specific groups of long-term care facilities, homelessness, essential workers, and incarcerated populations. And in our webinar, we discussed that individuals from racialized or newcomer populations are disproportionately represented in the homeless population in Canada. And we noted that individuals experiencing homelessness or housing instability are at higher risk for COVID-19 due to such factors such as inability to self-isolate and practice social distancing, including those that are living in overcrowded households, as well as difficulty accessing supports and services that have either closed or are operating at a reduced capacity. We also covered the concerns with long-term care facilities and the differences that private and public facilities were having, and the global rate of infection that was present in these facilities. And so this is something that Jade will go over later. And we also discussed the overrepresentation of Indigenous people and Black people in federal prisons. And at the time we discussed this, there were 82 positive cases of COVID-19 in federal prisons, and that has since changed to 363 with 2 deaths. And we also focused on essential workers, but I'm not going to cover that since Mary Chu covered that earlier. And so the objectives of these webinars were for participants to view the COVID-19 pandemic through an anti-racism lens, to develop an understanding of current human rights implications of COVID-19, to recognize how COVID-19 has been framed in the media, and to become familiarized with actions people can take to support their mental health and well-being. And we measured the successful outcomes through feedback and surveys provided to each participant after the webinar, which we will discuss later. And so now I will pass things back over to Jade.
Thanks, Tara. So now we're going to discuss some of the highlights and changes from each of these webinars. But before we do so, in the next slide, I'm going to highlight just a bit of context on when this was happening. So our series of webinars took place in April and May of this year. So during this time, most of the country had gone into lockdown, businesses and restaurants were closed, and many people were working from home. Many settlement agencies were not offering in-person services or had shifted to remote delivery. And at this time, there were just over 26,000 cases in the country. Now there has been almost 340,000 cases in the country, and most provinces had started to reopen in the spring and summer. However, right now we're seeing much of the country experiencing a second wave of infection. Many people have now been working remotely and attending online events such as this for months now. And Zoom fatigue has caused people to feel tired and uncomfortable. And many people are also experiencing COVID fatigue, where frankly, they're just tired of hearing about the pandemic. And both of these points weren't really something that was an issue when we were first delivering these webinars. So in the next slide, our first section talks about data. So during the webinars, we had to pull significant data from the US and the UK on how the COVID-19 pandemic was intersecting with race and ethnicity. So at the time, there wasn't any data available in Canada, so we needed to look globally. For the information on Indigenous communities, we looked at past data from the SARS outbreak and identified protections and changes that had occurred since. And based on this, we were able to identify the risk that an outbreak of COVID-19 might have on an Indigenous community. We can also look at some of the examples on this slide of data that we had pulled from. So the graph on the bottom is from the AMP Research Lab in the United States, which found that Black individuals faced higher mortality rates. And this table was taken during the time when we were presenting. And it's also important to note that they've since updated the information on their website. And the table on the left is from the International Long-Term Care Policy Network, which found that case rate fatality among residents in Canadian long-term care homes was much larger than that of the global case rate fatality among individuals over the age of 80. So unfortunately now we're still seeing gaps in the data being collected, but some provinces have started collecting race-based health data during the pandemic that we're able to look to. The chart on the top right is from Toronto and provides some clarity on the situation. We can see the disparities of the Toronto population and the share of the COVID-19 cases. White people in Toronto make up 48% of the population and have 17% of the COVID cases, whereas Black people in Toronto make up 9% of the population and yet have 21% of the COVID-19 cases. There's also new research available on the intersection of COVID and discrimination. One report from StatCan found that those who have said they have experienced discrimination over the course of the pandemic, the most commonly reported forms were based on race and skin color, followed by age, physical appearance, ethnicity and culture, and sex. And looking at some of the data on the economic impacts, multiple sources have also found that newcomers have been hardest hit economically during the pandemic compared to non-immigrants. One report from the Association on Canadian Studies found that economic hardship was greater for recent immigrants as opposed to established immigrants. And the gap further widened when we looked at visible minority immigrants and non-visible minority. So why were these findings important to communicate to our attendees? The data was important to increase the awareness of who has been disproportionately impacted by COVID-19 and the need to collect data on this in the Canadian context. For settlement practitioners, knowledge on how their clients have been impacted by the pandemic was important to be able to respond and raise awareness of these issues. We pulled together data from many different reports and studies, so rather than focusing on a single issue or area, we were able to look holistically at the impact that it's had and continues to have on newcomers and racialized communities. Now I'll pass things back over to Tyra to discuss our actions.
Thank you, Jade. So one of our priorities in delivering this webinar was including strategies and actions that could be taken. And so some of these strategies have been adapted from existing tools and resources. And one of these resources is the diagram on the bottom left that shows the process for responding to hate. So this resource was adapted from teachingtolerance.org, and we changed it by adding a section on recognizing. So in order to appropriately respond, we first need to understand what we are responding to. And so if you can identify an action as racist, xenophobic, or oppressive, then people wouldn't respond because they don't know that they need to. And then so after an incident is identified, then a good strategy would be to interrupt, question, and then educate. So a way of doing this would to be making a statement such as, hang on, I want to go back to what you called the virus. Why did you call the virus that? Where did you hear that information? And then taking the opportunity to educate that person if you think that is an avenue that would work. And in situations where you yourself don't need to interrupt, question, and educate, then you can instead echo or amplify the message of someone else who has already responded. And on the next slide, I want to talk a bit about the CCE response model for hate incidents. So that was a resource that was launched this year. And as a result of this project, we decided to include a resource specifically on COVID-19 related hate. And so to give some examples of what this looks like and provide avenues for people to go to if they want to respond or report the hate. And next slide, please. And so now I want to talk about self-care and community care. And it was very important to incorporate this into all of the webinars because there has been a concern for mental health and community well-being. And recently a study by Mental Health Research Canada found that since the COVID-19 outbreak, the levels of very high anxiety have quadrupled, while the levels of high depression have doubled. And among those with an anxiety disorder or depression, their already high levels of anxiety and depression have doubled since the outbreak. And so we found it important to talk about mental health because of the impacts that racism and discrimination, isolation, and fear have on mental health. And we chose to incorporate self-care resources and exercises, as well as polls in the webinars to get people to be aware of the impact that this pandemic is having on their mental well-being. Next slide, please. And now I'm going to pass things over back to Jade, who will talk about these surveys.
Thanks, Tara. So one of the unique tools that we used throughout these webinars was the use of surveys to get a better understanding of the current situation and fill gaps in knowledge. We also wanted to know if attendees or their clients were seeing or experiencing an increase in racism and xenophobia related to the COVID-19 pandemic. And this also allowed for ActionDignity to create a platform for people to share incidents that they had either experienced or heard. So some of the highlights we included in this slide are that 71% of respondents thought that it was extremely important to have COVID-19 information available in their first language, which goes back to what Roche discussed in the previous presentation. And we also saw that 85% of respondents reported having seen, heard, or experienced racism and xenophobia related to COVID-19. And the most common locations where hate incidents were occurring were online, on the street, and in grocery stores. This really helped to inform our work by getting an understanding of the frequency of hate and learning the most common locations that allowed us to look at finding different response strategies that would work best for people who have been affected or have clients affected by racism and xenophobia related to the pandemic. In the next slide, we talk about the various resources that were shared for future learning, such as the ActionDignity COVID-19 online resource package, which includes links to the first language information packages available, links to mental health supports in multiple languages, and a list of available government assistance. So resources such as this were important for us to include so that individuals as well as frontline workers were able to access information and explore different resources even after these sessions had ended. So another example on the right is the ACT Foundation COVID-19 Anti-Racism Incident Reporting Center, which is another resource that we shared where people were actually able to report incidents, and documenting this would really help to get a better idea of what the impact has been. So on the next slide, we talk briefly about the outcomes of this webinar and how we measured them. So as we mentioned at the beginning of the slide, outcomes were measured by our feedback surveys. And here we've listed a couple of the responses that we received. So one person noted that it was shocking that Canada was not collecting race-based data on who has been infected. And this situation offers an incredible learning opportunity to address inherent discrimination that exist against vulnerable people, So some other notes are that participant responses to feedback forms allowed us to note an increase in awareness and also how they plan to use tools and strategies that were shared. So examples were increased awareness of the extent that subtle racism has occurred during this pandemic, integrating different concepts into their programs, becoming more self-aware and assisting clients, and also looking at sharing the results of polls, which some people noted was helpful to be connected with some of their fellow attendees. So based on this information, we can revisit the purpose of the course, which was to increase the capacity of the settlement and integration sector to support newcomers experiencing discrimination. Although things had shifted and changed to address new issues that had been amplified by the pandemic, we can see an increase in awareness. However, there's still a lot more work to do, and the situation is changing every day. And just because there is talk of a vaccine, it doesn't mean that the inequality is over. And finally, we're just going to wrap up by discussing where we are now and what might we approach differently. So some issues that we didn't touch on in the previous webinars were schools. So at this time, everyone was still in lockdown. This brings up certain questions about how online schooling has impacted families and students, their mental health and well-being, and also accessibility and digital literacy that was mentioned previously. So looking at the long-term effects of this. Next was specifically immigration and travel restrictions. So looking at what new policies or restrictions have been implemented and how this has impacted people's lives, specifically for newcomers living in Canada who have no longer been able to travel to see family or friends. How does this impact their health and well-being? Or those that have delayed processes of immigrating to Canada. And finally, looking at hospitals, many are now reaching capacity. So looking at what the long-term effects of PTSD are for workers and people who have lost friends and family. So I'll now pass things back to Tyra to talk about what now.
Thanks, Jade. So now I'm going to talk about now if we did the webinars today, what would we cover? So one of these concerns that we have is with the tracking app and the lack of a national response strategy in each province or territory kind of taking their own approach. And so this can make it difficult to get a sense of exactly what the situation is in Canada. And we also wanted to mention the challenges with tracking and contact tracing. And because of the number of cases in Alberta and the lack of a widely used tracking app, Alberta Health Services has determined that it will only directly notify close contacts of cases of COVID-19 confirmed in 3 priority groups, which are healthcare workers, minors, and individuals who live or work within congregate or communal facilities. And also within Alberta, the tracing app, AB Trace Together, which launched in May, has been downloaded more than 260,000 times, but has only been used to track down the contacts of approximately 20 cases. And also we would cover some questions about CERB. So for example, who is eligible and what are some of the new challenges and limitations with the CRB benefit. And we would also talk about the current strikes in Alberta and how these strikes were as a response to cuts in healthcare in our province and the strain that this has put on healthcare workers. And at the same time, there are a number of anti-mask protests occurring, which will undoubtedly increase the strain on healthcare workers in the province moving forward. And we would also cover the additional impacts of COVID-19. So as Jade mentioned, there are some concerns with the vaccine. So regarding distribution of the vaccine, which communities will get it, which countries have access to it, will Indigenous communities have access, and what about incarcerated people? Also, we would talk about the concerns with social isolation, and also the concern that this has with domestic violence and increased rates. And finally, we would talk about mental health and addiction and the increase in opioid deaths, especially in the early days of the pandemic. And so we have these questions here because we want to encourage service providers to look at the impacts that all of these additional factors might have on their clients. And so now I will pass things over to Jade, who will cover our closing statement.
Thanks, Tyra, and thank you everyone for joining us for this presentation. We hope you enjoyed it. And apologies that we have cut into some of the question period, but if you do have any questions, I'll pass things back to Raeesa, but we've also provided our emails here and websites if you do want to connect with us in the future. Thank you.
All right, thank you, Jade and Tyra. So I know we only have a few minutes left, but we're going to try and get to some of the questions. So I'm going to start off with the most popular one for Jade and Tyra. Have you seen data on COVID-19 and how the effect of race and those who have different abilities intersect?
That is a great question. I actually haven't seen any of that data, but I think that is incredibly important because I think a lot of the data we are seeing is tending to be focused on one area of oppression, but we're not seeing a lot of intersectional data, which I think is really important to identify who is at most risk during this pandemic.
Okay, perfect. So the next question is, I believe for either Sarosh or Mary Chu, a couple people have asked this. How could ethnocultural organizations and settlement agencies better support the rights of workers?
Well, I can go first on that one. I think that programming itself. So I don't know if the question by workers means specifically temporary foreign workers or just workers in general. But I think the answer to both is programming. With the recommendations I was speaking of, one big part of expanding programming outside of the sector, and this would apply to settlement sectors, and I would think ethnocultural community associations as well, is to try to not just support the newcomers and the racialized individuals themselves, but support the institutions that they operate in, whether it be employers or not. When it comes specifically to temporary foreign workers, I would just add part of that is right now limited due to lack of fundings, specifically towards services aimed at temporary foreign workers, in which case there's also an advocacy angle, especially right now with provincial governments in terms of working with them to highlight that need and ensure the resources are available. But I'll turn it over to Mary too, if you want to add to
that. Thanks for that question. I think one of the most important things that we could do, especially with the support of ethnocultural organizations, is education and awareness in the first language and in accessible ways. Because there's a lot of materials out there in English and devoid of their day-to-day situations. So one of the most effective ways is to collect stories of these workers and connect it to the bigger picture of policies and systems. That way, the workers will gain more courage and deal with their fears of speaking up, and also provide them with opportunities to express themselves in their first language, using their own cultural practices and beliefs as a base for understanding their rights. The other thing too is, beyond the benefits that they need, we also need to focus on rights, because this is the best way to empower the workers, speak for themselves, and address policy issues from their perspective. Yeah, thanks.
Perfect, thank you. The next question, and I'm not sure who this is for, but anyone can jump in. Are there promising practices around digital literacy and newcomers that could be shared or that you know of?
I can go. I'll speak from the experiences of the ethnocultural communities that we're working with. First of all, we can talk about serious matters in a fun way, in a celebratory way, and in an interactive way, using the different online platforms. So what we've done was, for example, we've asked some of the artists to participate in making activities more accessible to children and families. We're making all these education activities and engagement in family atmosphere and family setting, where we have activities for children, for parents, for the older generations. And so incorporating arts, collecting stories, doing films. Sometimes they use their own cell phones to demonstrate what they do on an everyday basis, and look at all the positive experiences and the positive initiatives that they are doing to address the big issues and the big picture. And then we also do a lot of activities in their first language. And of course, as I've heard it from Sharos, to providing the technological assistance that they need. So we do some tutorials on how they can manage their Zoom. We've rented or we've applied for several Zoom platforms to lend it out to different ethnocultural groups, so they book their sessions online.
Perfect, thank you. So I believe we're out of time now. So if we didn't get to your question, apologies, but feel free to contact us. Our contact information is in all the presentations just underneath the video. But thank you again for joining us. We hope you enjoyed today's workshop.